Today, I'm talking to Zudin Puthucheary, who's an intensive care specialist, and Eve Corner, who's a physiotherapist. We've had lots of patients in intensive care with COVID-19. What we really want to know is, how do we manage these patients when they get home?
A lot of our patients are really, really weak. They struggle to get off the toilet. They struggle to get out of bed by themselves. They really struggle to eat. A lot of them have difficulty with their swallowing and they've lost their appetite. They can often find it difficult to do simple things like hold things and sort of organize their day. And this then is alongside of their inability to sleep and perhaps organize stuff. And this brings with itself all sorts of mental health issues, including post-traumatic stress disorder. So they're not in a great state when they leave intensive care. And this post-intensive care syndrome can last for 6 months to a year.
Are there any particular problems that the intubation leaves them with?
Intubation and sometimes the tracheostomies that we leave patients with can lead to swallowing problems, okay, and speech problems. And the really key thing is that it's not always so obvious to us at the bedside clinically who's got swallowing problems. And it can manifest itself in pain, a loss of appetite, coughing, and very rarely aspiration. And that's why we've learned to actually get our speech and language therapists involved in this quite early on, because they can pick up the subtleties that we can't see that really affect our patients.
What should the priorities be for us as GPs?
Recognition and talking through with the patient so that they understand that what they've been through is a normal part of the ICU recovery. Reassurance, close monitoring of their medical status and their functional recovery and their psychological recovery. We need to try and make sure that they're getting a full biopsychosocial assessment, so we identify all of the problems, and then we can deliver rehab interventions to help to support them and get them back to work. Another key thing is that a lot of ICU patients, 20% roughly, will get readmitted to hospital within 90 days of discharge. So keeping a close eye on their medical stability is also fundamental.
I would start by saying, don't worry, you aren't the first person to have had to go through this. Okay, we do know you're not alone like this. You need to eat better and you'll need protein in your diet to put on muscle and try and get stronger. You'll need to do exercise that you can do and you'll have to build it up gradually.
What exercise should these patients do in the first week when they're home?
I would encourage them to do as much activity as they can within the limits of their breathlessness. I would encourage them to try and get outside daily, be that in a wheelchair or walking, whatever they can do. Getting sunlight is really important. I would encourage them to try and do as much functional tasks for themselves within the level of their disability as well. I would reassure them that if they get fatigued the next day, then they need to think about maybe altering their activity levels and pacing what they're doing a little bit more. There's no hard and fast rule, but do a little bit every day, as much as you can within the realms of your fatigue and your breathlessness, and try and get outside as much as possible and spend time with family and loved ones for that emotional support.